Good afternoon and welcome to Corona Walks number 8, Risk and Expertise. We're starting to come out in the open. Things are changing. Borders are opening again. Well, maybe not in the UK. They seem to be closing them down just as everybody else is opening them up. And as we come out from the lockdown and the harsh separation, we come out into the open, the devastation. And I picked this place for today's video. It's symbolic, really, of where we are. So where exactly are we with this corona, COVID-19? More than 60,000 dead people. I never believed in my lifetime this would happen in the UK. More people dying every single day in the UK than dying in the other 28 European countries put together. And our Prime Minister and Health Secretary think this is a roaring success and are proud of this. As a person who's proud of my country, I'm ashamed of it. I'm absolutely ashamed that they could think this is successful. This is absolutely awful. Let's look at this for a moment. And one of the issues here today that I'm interested in is risk and expertise. What does it actually mean to be an expert? What is an expert? Am I an expert? I have a PhD in psychology and 2 degrees in anthropology. Does that make me an expert? I've studied crisis management for more than half of my life. Does that make me an expert? What about the doctors themselves and the medics and the biologists and the chemists? Is it safe? Is it not safe? What is dangerous? What is safe? Is it safe for me? Is it safe for my children? Is it safe for very young people? Is it safe for them and dangerous for me? When we had the SARS, it turned out that SARS was dangerous for young, fit, athletic types, but it was harmless to babies and to old people. Now we have something that's lethal for old people, but mostly harmless to younger people. Risk and expertise has always perplexed me. I remember when we had the last beef crisis, and we were being told by people with PhDs from London that British beef was absolutely safe. And yet people with PhDs from Paris were saying that British beef was dangerous. They were both taught by the same methodologies. They were both taught the same expertise. They probably read the same papers to get their PhDs. And yet, one group, funded by the British government, said it was safe, and another group, funded by the French government, said it was dangerous. Now we have a situation where we have one group of scientists who are struggling to get their voices heard, and they're saying, hang on a minute, I'm not sure we agree with what the British government are saying. Then we're being told they're not allowed to speak. This is an old story in the world of risk management. Which expert do you bring forward? Go to any court and watch negligence cases, medical negligence cases, and you have the prosecution and the defence, and the prosecution brings forth medical experts who will say that what this doctor has done is standard procedure, an example of excellence. And on the other hand, you have the defence bringing forward their own experts who say, also medically trained by the same medical training, that this is a non-standard procedure, that they would never have conducted this in this way, that they would never have administered those drugs, that they would never have treated that patient in that way. And then we're left with this fight in between these two groups. Risk and expertise is a somewhat thorny issue. Who's telling the truth? Who's lying? Or are they all telling the truth but from different perspectives? It's a bit like car accidents where everybody claims it was the other person's fault and produces very good evidence to the court or to the insurance companies to suggest that they were completely blameless and nothing they've done was wrong. And yet we're left with the reality, which is an awful accident, potentially fatalities. My concern is, are the experts being silenced, or are the experts being lent on heavily? We see large amounts of money being spent on either buying or testing drugs that we know don't work. The drug with the name that I cannot think the name of here, and I don't have the notes to even read it, something that sounds like what you put in your gin and tonic that President Trump has been recommending. Apparently the NHS bought masses of this, or were told to buy masses of it by our great health minister, that we should have it in reserve. What on earth are we going to do with it? We're being told that we have masses of PPE equipment that doesn't work, is ineffective, should never have been bought. We're being told that we have experts in the NHS who could do drug testing, who have been doing drug testing since the NHS existed, and they haven't been allowed to do their work because private companies have been brought in. Then we're being told that we have this app, try to find the cases where there are live cases of COVID-19 in the community. And again, can we trust this app? Because we have a group of experts who've been commissioned to run and develop this app, who apparently are selling our data or using our data to supply a company that we know manipulated what we read on the internet before the last election and the Brexit election. Do these people really have our best medical interests at heart? Or are they up to some other sort of game? I'm sorry I've not been around for a couple of weeks. I've had a few issues to deal with, which were beyond my control. I hope I can be back a bit more often now, and there'll be some more Corona walks coming up in the very near future. I love doing these, and today the atmosphere is just right. The forest is wet again, it's dripping. It's the birds are singing very loudly, you can probably hear them. And look around me, you can see the devastation where the forest has been cut down. It will regrow. Just like our society will regrow. But for the 60,000 people who have been cut down, they will not regrow. They will not have that chance of life again. Our government have foolishly allowed them to die, allowed this virus to spread, have at every opportunity made the wrong decision. At the beginning, they even wanted to try to infect the entire population because they thought this was the best way to handle it. We now know that they have killed 60,000 of us. If not by design, by their own stupidity. I look forward to seeing you all again, and thank you very much for listening.